Welcome to the Journey Podcast, a show about health, wealth, and happiness. My name is Adam Bruderly, and I am joined by my co-host, Michael Baker. Whether you're looking to revamp your lifestyle or seeking a spark of inspiration, join us on this journey and let's explore the world your health and wealth make possible.
All opinions expressed by Adam and Michael and any podcast guests are solely their own opinions and do not reflect the opinions of Journey Wealth. This podcast is for informational purposes only and should not be relied upon for any health or financial decisions.
Welcome back to the Journey Podcast. Today we are joined by Dr. Brad Patton, who is the founder of Acropolis Health. On top of that, he is a father, a husband, a physician, and really a believer in wellness broadly. Brad, thank you so much for joining us today. Really appreciate it.
Thanks, Adam. Appreciate being here.
Great. Today, one thing we talk about at Journey Wealth are the 4 pillars. We've talked about them on previous podcasts, but I'll just reiterate them because there's really 2 key components I think you're going to touch on today. When we talk about the 4, we talk about spiritual wellness, physical wellness, mental wellness, and financial wellness. And I think for what you're doing with your wife, Megan, at Acropolis Health, really anchors to 2 key pieces of that, right? It's the mental wellness side and the physical wellness. So before we really dive into a lot of the content, and by the way, I'll preface, 1, I'm not a physician. My wife is, and she always yells at me like I pretend like I know these things. And 2, I do love this space, especially the physical wellness one. So, you're going to hit home for me on a lot of topics today. But really, before we dive into that, I'd love to just hear, how you got to turning your past in the medical space into Acropolis Health. How did you get here? What was your origin story?
Absolutely. So, I grew up in a small town in Arkansas. Being a physician was something that was very foreign, never even really thought about it, medicine as a career. And so growing up in a small town, relationships are important. The people around you, the community around you, these are the people you come to rely on. There's a lot of identity there. I didn't understand it at the time, but as I went through my studies and found myself in medicine, I started to realize how much those relationships were so important. Also, some amount of self-preservation, investing in yourself, almost that being your hedge for the future. And going through my studies, that training in medical school got me into primary care and thinking like, these are people I can have long-term relationships with, really start to try and understand. They can understand me, so we can build this deep relationship where we know a lot about each other and try to affect change through that. And when I got into practice in a large health system, I found it was very difficult to do a lot of the things that I was looking to do. And I also found that myself, getting into my 30s and 40s, realizing that I didn't really see any of my primary care colleagues as an option that boded well for me and what I wanted as a consumer for a physician. Wanting somebody that could connect with me more in a conversation about prevention. Hey, you've got a lot of healthy habits. How do we cultivate those? How do we trim some of the proverbial fat with bad habits? And how do we investigate along the way to help drive a lot of that decision making? The healthcare in America these days, for better or worse, a lot of the resources are pooled into treating complex diseases, which I'm very grateful for sure. A lot of the technology and innovation is around surgical procedures, the invasive procedures we can do that aren't done anywhere else in the world, which is all great, but it's all after the fact. So my interest really started to grow into how do I connect with people at the earliest possible opportunity to help shape, cultivate good habits and help illuminate along the way behaviors or patterns that might be well suited to just start to let go of. And that's what pushed me from being in a traditional setting to, my practice now in Acropolis Health, working with people through long form dialogue, close relationships, cadence of structured visits to really see that, I think there's a lot more to this landscape than we've previously considered.
Yeah, it's amazing. There's a couple things I want to pull out that you just shared, but there's a couple stats I want to put out first. And, I'll preface this too, that we've had the opportunity to work together now for a number of months or even a little bit longer than that, right? Probably 6 to 9 months. But there's a couple things that I think resonate that we've touched on that I'd love to pull in and then like set up kind of really what you're doing now, because I think it really, truly is differentiated, right? You came from a system, right? A larger healthcare system. I think now the statistic is about 75% of all doctors operate within a large healthcare system, right? So, 25% are kind of independent in that world, which really, I think, to your point, changes the dynamic, right? And I think the other piece of that, the one that blows my mind at times, I think the stat is, on average, a typical health with your primary care doctor, a typical appointment lasts anywhere from about 17 to 21 minutes, and 1 in every 4 lasts about 12, right? Why I mention that is the system to operate in, and specifically what you said about communication, relationships, and really engaging with clients. And I think the term I've heard you use is precision medicine or precision health. Could you elaborate on that and, how those points we just mentioned statistically integrate into what you're doing now?
Absolutely. And I think the estimate of 17 to 21 minutes feels very generous in my experience. The precision piece to sort of contrast that against where we've been previously. So, when you're taking care of most primary care doctors have 2,000 to 4,000 patients that they're sort of responsible for, like allocated to them. And you may see 20 to 30 of those people a day, sometimes more. And so these short office visits, they just don't offer the opportunity to really tailor care to a specific degree to patients. There's a lot of standardization of care approaches, certainly guidelines that are evidence-based, which are fantastic and very helpful for clinicians as far as guiding decision-making. But at the end of the day, you're just hoping to do the greatest good for the most people without digging too deep. We counter that with, or contrast that against, a precision-based approach, which is really scaling things down, working with a smaller number of people so that you can know more about these people and truly start to tailor investigation approaches, treatment approaches, also have the patient be more educated, spend more time educating them on topics so they can be more involved in the decision making. That agency with patients is a piece that really seems to resonate these days. There's a growing demand of consumers wanting to understand these variables better so that they can be more involved in the decision-making process. And so that precision piece, I think, is really, it hallmarks there. I mean, you see a lot these days in the precision genetics, there's things of like tailoring cancer treatments and all those things. Again, that's, I would delineate that from, what we do in primary care. We use the word precision. It's more about, each individual person being as unique as a fingerprint, whether that's the variables involved in what affects their decision-making on a daily basis or how they prefer to navigate their approach to their health.
That's, I think that's amazing. I think I would pull also what you mentioned, I've read a lot, and I would kick this back to you, right? Like some of the best medicine is preventative, right? How early you catch something, how early you can get out in front of it. I think, for example, just a small aside, I think, 80% of U.S. adults, according to a survey, suffer from some type of back pain, right? Like, that feels like that's a preventative opportunity in that space. And, that's a very broad topic, but what have you noticed in working with clients? Like, what would you, have found the most rewarding in being able to bring that type of preventive medicine or that precision health to clients? And what have they shared with you that is truly like impacted and helped steward you, knowing you guys are moving in the right direction in really an untapped space? Yeah.
So to unpack the first part, on my end, it's just the opportunity. That early detection is a great piece. There's a patient that I worked with in our current practice, one of the first patients that, was an early adopter of enrolling in our practice. And this guy had an issue that had popped up in a radiology scan incidentally years ago. And the standard approach was, hey, this thing is relatively small. We should just watch it and kind of see how it goes. Well, this was a guy who didn't really have a relationship with a primary care doctor or someone to kind of advocate for him along the way and make sure our cadence of surveillance is in place. So when he showed up to me in reviewing his records, we got done with our conversation and said, hey, elaborate on this piece. Let's talk about this because there's some loose ends here that I think we would be well advised to tie up. He seemed to be like, yeah, I agree with that. But in the past, it's kind of been told that it's really not a big deal. Just keep an eye on it. I'm not having any symptoms from it. Well, all it took was a series of a few things, simple scans, a consultation with a specialist to realize, hey, this is a cancer. Let's get this out of here. It's really early, but we wouldn't advise waiting now that we know what it is. And this was just something that just took a little bit of dialogue and explanation in my office for him to grasp the importance of it. And he was in complete agreement and allowed us to just get that piece out of the way and move forward. And it could have been a much bigger problem. Better job over the years of connecting with people in relatively stable or good states of health and encouraging connection in that state. But as physicians, we've largely marketed ourselves or entered the market at the point where disease is already present. We're down this path. Let's try to manage or treat an active disease. And so, there's always a little bit of surprise on patients' end when we're talking to them about, yeah, you're healthy. Great. This is a perfect time for us to connect because let's help investigate. Let's assess with a deeper set of variables to really look at more data and determine, are you as healthy as you think you are? And not for the purposes of trying to find a problem, but mostly just to say, let's look at this problem more comprehensively and ensure that the steps you're taking align with what your desired outcome is.
Yeah. That's great. I mean, one, thank you for sharing the example, right? Like hearing that story of a client, that like those are the things that I think that resonate more than most across any type of client, doctor-patient type relationship, right? And being able to share that story and help them understand by spending the time, the questions, the relationship that you were able to bring to them first and foremost. And I think with that being said, one of the things you just mentioned, I'd love to pull on a little bit is you said, hey, maybe you're not as healthy as you think you are, right? Like maybe you're not in as best of shape as you think you are. Could you unpack that a little bit, right? And to talk a little bit more? It's a big question.
I'll use a personal example too. I mean, just yesterday, I was down at the Akron University Human Performance Lab getting, as much data as I could gather on myself with that. And I've been someone who, exercise, nutrition, these are things that have lived at the forefront of my own personal health priorities for years. And I think when we think about assessing our health, sure, physically, how do we feel? How's our body function when we challenge it? How does our lab work look? Functional metrics, these kind of things. And I think most of us want to focus on the things we're already doing really good. I think that's inherent to us as humans. But anything that's perceived as a shortcoming, we're a little bit critical of ourselves of. And so yesterday, a big illuminating thing for me was my VO2 max. I mean, it wasn't bad by any stretch of the imagination, but what it did was force me to confront that, hey, I know I don't invest enough in this metric, and the value of it is so high that now this has to become something that I'm not trying to justify. I'm doing all these other things great. My labs look great. All these markers look good. But that's a piece that, and it doesn't give me, in my day-to-day, no noticeable difference. I get through my workouts fine. I do all these things. But it's certainly a piece that I feel compelled to say now, look, I need to just kind of check a little bit of my own ego and resistance and really push into that a little further.
Yeah, thanks for sharing that. I think that's a really thoughtful example, right? Because, and this maybe leads to my next question, for example, right, I go to the doctor, fairly healthy. I love to work out, try to eat well, do all these things. I go in and do try to consistently show up and say, hey, for your 6-month or 12-month checkup. And it's the standard routine. How you feeling? How you doing? Take your blood pressure, draw your blood, all those things. And you walk out and you're like, yeah, I'm doing all the right things. But then I have a conversation and talk to you like we have had, and you open up Pandora's box of all these other, in a good way, right? Of all these other metrics. Could you elaborate then a little bit in terms of those two parallel paths, right? Like when you think about that traditional relationship with your primary care doctor, and then the way you're moving with precision type medicine and health, how do those differ and differentiate a little bit?
Yeah. So in the traditional model, you're just trying to get some degree of care to as many people as possible. So the constraints in that model are just time and resources. You've got a limited number of clinical staff and an endless seeming number of patients you're trying to navigate. So again, time is the variable, the rate limiting step. You're just not going to have the time to dig in as deep as you would like and excavate as deep as you would like. And so in our precision approach, again, we're scaling that down so that we can really start to elaborate on some of these conversations. Okay, great. You've got a lot of healthy habits. Let's talk about, where do you perceive yourself to be really grooming healthy habits well? And what information have we looked at to assess how your body is responding to those healthy habits? But also, I think the illumination of those unhealthy habits that become casual habits. One of the most common examples being alcohol intake. Alcohol is something that's woven so casually into our social fabric that most of us don't really think about how frequently it comes into our life, especially if you're a moderate consumer. However, the downstream implications of that can be disastrous and work against us in terrible ways. And like most other things, those little things compound so greatly over time when done regularly, just the way that small investments in positive habits over time compound in a positive way. But it's only through deeper conversations that you gain enough trust with people that they'll honestly disclose to you and feel in a non-judgmental space a way to have a conversation about just assessing how useful is this practice in my life and what's the utility of it? Where does it fit?
Yeah, I think that's a great one to speak to. And I think, again, I relate it back to how you started the conversation and we opened, right? It's your relationship with the client. It's that level of trust. It's that time piece that we actually talk about a lot at Journey Wealth too, right? Time is a key component for many of our clients and how they think about what wealth means to them and what they really want out of life. And I don't think it's much different, right? Like coming to you and asking what they want out of life. And when we think about that financial wellness pillar, right? Because all the things you need to start doing now to do whatever you want to do 15, 20, 30, 50 years from now, right? Like when you think about lifespan versus health span, right? And what that really means, meaning, medical system is pretty good at keeping you alive for a long time. Totally. But what is that lifespan like, right? Like what does that last decade feel like? And with that being said, you kind of mentioned, for example, alcohol and its relationship to people. I would ask, what is one of the key questions you get, right, asked most often about the impact to someone's health, right? They think is the most important. What's one of the least that gets asked that has a huge impact on someone, right?
Yeah, I think that's a great question because a lot of people come into our office asking, what can I take? What's a hack for this? It's the world we live in these days where everything's about efficiency, and we're all, the bandwidth we have is seemingly perceived as minimal. So how do we be most efficient with our efforts? And I think that's probably the piece where we try to stop and reframe the idea about how we get there is not as much, what do we take? What are we looking for to help shortcut this problem or create this? It's more, what are the habits we have in place currently? And how do we adjust some of those habits, or what's preventing us from really doing the things that we've got kind of a foregone conclusion that these are pieces we need to invest in, but there's resistance to that. And I think, everybody's answer for that is a much more complicated, complex problem. But, it's a lot of things. It's also stress and emotion and the mental health piece that you alluded to earlier. These are a lot of where the barriers sit. So, again, back to the time piece. If we're not taking the time to invest in these conversations, we won't even know how or if these things are affecting or becoming the barrier. They are the barriers that prevent us from progress. So usually that question of what do I take, we try to just peel that back. That's probably the most common question that we get there. We try to say, look, that's probably not our starting point. Let's understand the framework of your day right now and figure out how we can adjust the things we're already doing to align with what your stated your stated goals are.
Yeah, that's really well said. I had a friend of mine, they're in the interior design space, and they were asking me a question, knowing, right, wellness for Journey. And we were talking, just kind of having a conversation about that. And I get asked that same question just as the person that, like in my old career, as the runner and the health person, I would like, hey, what supplement should I take? And, what vitamins or what new shoe should I get that it would help me run faster? And I would often position it back of, well, let's step back and like, hey, are you just eating a balanced diet? Are you working out? Are you getting good sleep? And they may say, oh, no to this and no to that. And I'm like, well, the vitamins and the supplements really don't matter, right? We're talking about around the fringe. And my analogy was like, to her was, when you're designing a house, right? If you walk into the house and it's half torn down and a disaster, it needs, like, her putting little things around there to style it isn't going to make it look that much better.
Oh, yeah.
So, I think then back to the foundation, right? The foundation of the 4 pillars, the foundation of how you approach precision health. When someone comes in to talk to you, like, what are some of those key components you speak to? You've talked to me a lot about metabolic health, right? Right. That's really, that is the foundation. And we can talk, and I'd love for you to extrapolate on that, because there's a stat I read the other day that just blew my mind, that only about 7% of all American adults will attain metabolic health, which just is shocking. When you think, you do the math, 7% of 350 million people total. I know those aren't all adults, but it just, I couldn't believe it. So could you elaborate and dive deeper on that?
Absolutely. So yeah, metabolic health is something, we hear that term used a lot these days, but what it refers to, and the way we use it with our members and patients is, blood sugar, cholesterol, blood pressure, body composition. These are all factors that play a role in that metabolic health piece. Our metabolism is something that it fluctuates based on need. For most of us, as we age, and like why, that staggering statistic of only 7% of Americans will reach it, 1 in 3 Americans has metabolic syndrome, which is inclusive of things like obesity and high blood pressure, and high cholesterol levels, these things that predispose us to risk for various conditions like diabetes and heart disease. But that metabolic health piece is something that we really just scratch the surface of in traditional medicine. There are pretty superficial markers that we kind of hang our hat on as like, okay, these things aren't abnormal, so there must not be a glaring problem there. And in our practice, we like to look much farther upstream to try and determine where are the earliest signs of a potential problem, so that we can help illuminate and enact change at that point to try and adjust the trajectory and the course, because these things like A1C and fasting blood sugars, these things are great to know. Patients, everybody should know where they sit on that metric. But by looking at additional markers, like taking into more of a comprehensive approach, looking at things like triglycerides, fasting insulin levels, diabetes risk index, and then overlay that on other metrics as well. How is your sleep quality? Assessing your sleep quality. Most Americans, most people, if you ask them how they sleep, I don't know. I go into bed, my eyes are shut, I wake up, they're open. But if you were to ask their bed partner or their kids or anybody that sleeps around them, they could have a totally different story of what's going on during that 8-hour incapacitated window. And, daily habits, nutrition habits, stress management habits, emotional habits, these things all have such a vital impact on our metabolism. At the foundation, like you said, is a piece that it merits assessing as comprehensively as you can, because that piece is one of the keystones that leads to so many disease states that are avoidable or at least delayable. And that upstream knowledge is where you're confronted with the opportunity to make a decision. And I think for most people, they don't even get the opportunity to see that before it hits. So, I think that's what we're hoping to do, is illuminate that at a much earlier point, if it does exist, or assess it and reassure that everything looks great, validate the behaviors, validate the approach, and say, continue doing that, and let's continue assessing it at intervals to ensure that still seems like a favorable path.
Yeah, that's great. To that point, I think the one word you've mentioned a few different times, which I love, is the reframing for people, right? Like, what is really important, and connecting the dots. Because what I mean by that, right? Like the stress you're having at work or at home, or in a relationship with a spouse or your children. Are you physically working out, right? So that stress component or that piece, like, do you have hobbies? Do you have relationships? All of these things are not mutually exclusive. And I think oftentimes, back to that 12 minutes you get when you go get that checkup, are you able to even share some of those things, right? And recognize that there's an underlying issue. So with that being said, when you're talking to a client or, talking to our audience here, where are 3 specific things they can do to kind of start down that precision health approach, right? One is work with you and Megan specifically. But to put it out broadly, like, where can they start? 1 or 2, 3 questions they can start to ask, or steps they can take to go down that route.
Yeah. And I think the number one step is find your why, find out what you want, start to ask these questions of yourself about what it is you want and why you're going to be seeking those things, or what you're willing to adjust in those things. The other thing is to educate yourself as a consumer about what your options are for healthcare. These days there's a lot of innovation going on in the healthcare space, and an awareness about practices like ours, which are emerging, with regularity. This is becoming. There's more consumers are finding their way to this because they want to take a different path, and I think being your best advocate, being your own advocate's the best approach. As far as action items for what you can do to try and promote your health and keep it very simple. I find it's wild how many people don't drink enough water. That sounds so simple on the surface, and we hear it all the time for different reasons, but it's such a vital molecule that we just don't consume. I mean, like seeing you here with the water now, there's no greater promotion of drinking water than when people walk into my office and have some kind of water bottle. I'm like, all right, great. At least this is living at the forefront of your mind, because hydration is key. The other thing is move your body, with intention, not just passive, casual. Hey, I have to walk across the hall to do this, or I've got to go down, to another office. It's like the intention of investing in yourself with movement is key. And the third thing I would say is, it's hard to whittle this down to 3. I would definitely say, Adam, but the third thing is, relationships. I think relationships would be very illuminating. If you, ask, why are these people important to me? Why do I want people to be important to me? Asking, am I validating those relationships enough? Am I giving those relationships enough? Because I think that ties into the first piece, which is like finding your why for doing things. What do you want to achieve? But yeah, those are 3 simple things that I would say, that everybody could do right now with no, you don't need an extensive amount of resources or other things. Those are pretty self-isolating.
Yeah, I mean, I think that's great. One being as people have repeatedly heard about, I'd love to run, do triathlon, all those other good things, and I learned about dehydration on a very, very quickly, right, and the impact it can have on your performance. So that's a big one to me. I want to anchor to the physical wellness piece, specifically the movement. I think the stat right now is only 25% of all Americans get the recommended amount of physical activity a week, and I think that's around 150 minutes, right? So 75% are not moving in some form or fashion. Could you talk a little bit about, I like to think sometimes that, movement, exercise, whatever we want to call it, could be that hack or that silver bullet at times, right? Because the benefits it has across all of those spectrums of mental wellness and spiritual wellness. and physical wellness. Could you dive a little bit deeper on the physical wellness side or the exercise side and, the impact there, right? Like, hey, one from a longevity perspective, one from all the other benefits of the metabolic health and everything it kind of anchors off from there.
Yeah, I would agree with you that if you're looking for something that you could conceivably call a hack or a super drug, exercise is it. You're right. I mean, the reason that things like VO2 max is the highest correlating variable with what your anticipated lifespan will be is because the way that you modify that number is through exercise, through intentional stress, challenging your body physically. So certainly on that aspect of metabolic health, exercise is key. But through all those domains as well. I mean, what exercise does for our mental clarity, being outdoors. I know you had just recently referenced some information about how much time Americans or how little time Americans spend outdoors. And things like creativity and connection and introspection and all these pieces that you glean from just being outside. It's the vitamin D, a lot of things that help. Again, these are all little things that fall into these buckets that have an additive effect. But yeah, the exercise piece, I think, when I talk with our clients, it's exercise is that thing that physically serves our body. We get physically stronger. We get an increased aerobic capacity. We're conditioning our cardiovascular system. All those things certainly are true from those challenges. But we're also challenging ourselves mentally and emotionally to find our barriers and challenge, can we push through these? And I think that's a great metaphor for the other aspects in life that are challenging. I think that most people that I know, and I know for myself, this is true, but going through my life, I lean on the lessons I've learned through my own trials and tribulations with, exercise and physical endeavors I've undertaken, some with success, some with not with success, and lean on those to, when I'm presented with a challenging personality that I'm working with, or a complex medical case, or trying to navigate the emotion of a 5-year-old whose shoe choice is just creating a meltdown. Like it's not that different. At the core, it's just it's a problem that you've got to solve in real time and try to frame it in what can I affect and what can't I affect? And focusing on the things that are not changeable variables is not the place to burn yourself. But I think illuminating these areas that, hey, that's an affectable variable, that's the place to devote your energy. But I think without that exercise and resilience and self-challenge that's often gained through exercise, I think you're not really equipped with all the tools.
Yeah, that's amazing. I mean, you're hitting, everything you just shared, I love, right? You've heard me talk about this over and over again, and I would 100% say that. I, as an ultra runner, I always tell people like a 50 or 100 mile run is like one of the best examples of how an experience of life, the ups and downs, the highs and lows, the great points and euphoric moments, and the ones where you're like, I just want to bail and get out of here, right? This is just miserable. But pushing through that, and you come out the other side every time much better for that. And one of the other items you mentioned is, when you talk to clients specifically, and what you just phrased there is really about connecting the dots, right? And I think what I've heard from working with you and working with Megan is when you guys talk to clients, that's really one of the key pieces. When you have the time to help people connect the dots and reframe their perspective and then reframe their beliefs, I think that's the biggest thing. So you do that for clients. What have you come through after, getting in and launching the business and working with clients in this new form or fashion? What has reframed your beliefs, right, in the precision medicine space and where it's headed?
Yeah, I mean, there's a lot personally that I've taken from this journey. I mean, I think one thing that allows us to be what we feel like is so effective for our clients is that we're implementing these actions in our own life. A big part of us starting this business and breaking away was to try and stick to that plan that that discussion line of, hey, if your family is really important, how are you aligning your life to fit with that statement? If prevention is really important, how are you aligning your approach to fit with that statement? And so I think that in the precision medicine space, where we're going to see this grow, because certainly I think this is a growing space. I think consumer demand is going to drive this. Patients are very interested in becoming active participants in their own health. But I think it's going to require a big mindset shift on the side of clinicians and, healthcare in general, because it's going to force clinicians to confront their own approach. You think about the common, like the cliche description of, 20 years ago, you go to the doctor's office and the doctor might be smoking in the exam room, maybe 30 years ago, whatever. But, it's still not an unusual scenario that you go into a healthcare provider's office and they may not seem to have the most healthy habits. And I think that the optics of that are challenging, because I think people want to feel compelled and convicted by the person they're working with. That connection is so important. And that looks different for everyone. But certainly, I think through conversations and through, again, just a healthy dose of humility and being able to allow patients into your life as well and clients to understand, yourself and your identity, that only serves to strengthen those, but it also allows people to really determine who's the best fit for me. Because I think that this movement into precision medicine is going to do a lot. You can't do it without transparency of intention, transparency of certain aspects of our own lives. I think that's just a necessity. Like for Megan and I, we're very upfront with people along the way. I mean, I'll answer almost any question someone has, some unsolicited. But I feel like that's important because, if somebody doesn't know where you came from or what your approach is, I think it's hard for them to put a lot of power and emphasis in what you're trying to talk to them about. So I think the two go hand in hand.
That's fantastic. And I will absolutely sit here and say that in the times I've sat across from you or the times we've been together, both yourself and Megan, I mean, you're living that life, right? I know the gym you have outside the smaller gym, your little box you have outside your house.
Sweatshop.
Sweatshop. The times I've seen you at our kids are in the same kindergarten class and they have this amazing experience every Friday called Forest Friday where they go out and they get muddy and they tear things up and they break branches. And, I've seen you out there volunteering, participating in that. I know you guys were at the pancake breakfast because they tapped their own sap this week. But I think that's incredible, right? Like, I think to your point, right? When someone sits across from you and you're validating them or having that conversation with that you're living that life, and kind of smirked when you said the smoking doctor, right? Growing up as a kid, our neighbor was a surgeon and he was like a 2.5 pack a day type smoker, right? I'm sure dealing with the stress and a few other things, but we saw it every single day. And I think it's really hard, right? If you're a patient of someone and then you're sitting on the other side and that's not what you're seeing as they kind of give that back to you, it's really hard, right? That level of trust and transparency doesn't resonate.
Yeah, it's a lot of mixed messaging. And I think that these days, where trust is the fabric of foundation, it's just a piece that we can no longer afford to ignore. I just think that's something we just need to confront as healthcare, as clinicians, but I think that consumers have a heightened awareness, about what they want out of that experience now, which is great because that's telling me the pendulum is swinging where, because nobody wants to walk into a situation and have just the scenario of terms dictated to them. I mean, I'm sure, nobody would want to walk into Journey and say like, okay, I have zero agency in this conversation. You're just going to tell me exactly what to do. And these are my marching orders and I don't need to understand why. Yet for some reason in healthcare, that's kind of that's the flag we've flown for a long time. And it's just not that appealing anymore. And I also think the outcomes just aren't proving that that's the best approach. It's most like mother thing. We send our kids to school for such a long time. And the point of that is to educate them. And I think as adults, we're not that different. We want to be educated on topics to drive our decision making.
That's so well said. And I think it's why we, not only from a friendship and a strategic partnership component with you guys, but you're walking that same path of helping your clients and or patients live their best life, right? And I'm going to pull it back to you specifically, because one of the things, we talk about on this show a little bit, the term Misogi challenge, whatever you want to call it, but I'm going to ask you, with that being said, right, like living that kind of type of life, is there something you have on tap for this year that does those things, what you just talked a little bit about, right? Your purpose, your why, getting you out of your comfort zone, something really hard. We shared in the last episode, it's a 50-50 chance of it actually happening. Have fun and don't die.
Yeah.
Right?
So yeah, it's for me, it's this running piece. I kind of had, I used to run when I was younger, not ultra distance, not long things like you've done. I've never run a marathon. I've done one half marathon in my early 20s. Since then, I had a lot of reasons why I kind of got away from running. To be very honest, I didn't enjoy it. I've always understood the utility of it. But for me this year, my intention is to, the Burning River is happening in the summer. They have a relay portion where you can string together 8 sorry souls to try and complete that 100 mile. And then you got 27 hours to complete that thing. So I'm in the process of trying to recruit 7 other individuals in my neighborhood to try and do this thing with me. And for me, that's something that I feel like both the build up, the training to, and the completion of would be that's my challenge for myself this year, because I think there's so much for me to learn from that process, and especially, like you said, investing in these aspects of health that I'm trying to demonstrate by my own actions that, hey, this is not something I want to do. A large part of me doesn't anyway, but I can absolutely see the value in it, and I will come out the other side better for it, for sure.
That's great. I'm very familiar with that course, both the front and the back. Well, as we close out, anything else you would want to leave for the listeners, right? Anything they can take away, and then more importantly, how can they find you guys?
Yeah. So, I think my big soapbox is advocacy. I think as anyone listening to this, be your own best advocate. Understand what it is you want. Be compelled by that, and find someone who can share that passion with you to work with you to achieve it. And then it's finding us. We hope we're easy to find at this point, but our practice is called Acropolis Health. We're myacropolishealth.com will get you there online. We have a small practice in downtown Hudson that we're actively trying to grow, because the demand has delighted us, and how much this has resonated with people looking to transform their health or just sustain a good path for their health. You can find us on most social channels as well.
That's great. Well, thank you so much for joining us. I mean, I love what you're doing. As you know, our clients work with you, and we love working with you guys, and it's amazing to see like the rocket type trajectory you guys are having. So
we appreciate the opportunity. I mean, there's no pleasure like sharing a common vision of ethos, intention, integrity. I mean, you guys embody that at Journey, and it's everybody seems to buy into it, and that's what makes it special.
Well, we appreciate it. No, thank you. And thank you for joining us. And please join us next time when we'll have Andrew Brush coming on. Really appreciate it. Take care. Thanks.